this is something that concerns you and me because these are medicines that we take on a daily basis. Some of these medicines are available over the counter. For a common cold, you consult or rather take paraqcetamol. And if you have any acidic reactions, you take a tablet called Pan-D. But let me tell you that these medicines, along with 51 other medicines, have been classified as, that they're not safe because they haven't passed the necessary drug quality test. And 53 medicines, viewers, not just one, but 53 medicines have now been flagged as a safety concern across the country as well. And the CDSCO has also flagged the alarm. And various doctors are also discussing about this. This is the debate as far as the medical industry is concerned. This debate is raging on because these medicines deal with our day-to-day life. Anybody who has a fever takes a paracetamol, but the quality of the medicine, as flagged by the drug regulator, is of substandard quality. Now, to give us more insights, we also have some guests joining us on this live broadcast. We have Dr. M. Wali of the Gangaram Hospital and Dr. Mira Desai, also a senior pharmacologist. Firstly, Dr. M. Wali, I come to you with this question that how unsafe are these drugs? Because these are go-to drugs. These are drugs that are available over the counter. So how do you tackle such a problem after years together of its usage?
Yes, you have given the right heading, scrutiny. Drugs should be under regular scrutiny because patients are falling sick regularly, drugs are being sold regularly, drugs are being manufactured regularly, drugs are being consumed regularly, drugs are being adulterated regularly, drugs are being substandard regularly. So scrutiny should also be a continuous process. In India, there is a big problem. If one drug is manufactured by several companies, so there is no quality control. Previously, each company used to claim that our ranitidine is better than the B ranitidine or C ranitidine. See, in abroad, one drug is manufactured by one brand, one code, one color, and can never be changed. And so many companies are not making one drug. So this is primary thing. Secondary thing is from the shelf the patient buys. So up to the shelf of the chemist, it is the responsibility of the company to supervise that what is being sold in their company's name. They cannot shrug the responsibility of not being vigilant over it, apart from drug inspector and other authorities. The company's representatives go from door to door, from chemist to chemist, monthly, weekly, daily, and they should see what is being sold in our medicine brand name. Number 3, the companies who are manufacturing, procuring the raw material and till the medicine is reached to the shelf of chemist is their responsibility. So you might have seen commonly a cycle carrying the medicines in summers without temperature control. You are showing a colored bottle. There is a reason why these colored bottles are used. Why? Because the temperature control is maintained, the radiation is maintained, and similarly storage and transport is equally important. How much the chemist buys, how much is his turnover, this is important. But the ingredients at the time of procurement till the whole process of manufacture should be meticulously supervised for each batch, each consignment, each transportation and each delivery. So these are the fine points, and people who are doing it are illiterate. They just keep the box of the medicine in humid condition or in sun, under the sun. So that is how the quality deteriorates. And now what they have got, CDSCO, what they have got is like drugs are not genuine. The company's responsibility, according to me, does not finish by saying that this is not our product. They are responsible for inspecting what is being sold in their product's name. And in many, many cases, this has happened in non-medicinal products also. Companies have a check what is being sold as pounds powder. Is it genuine or not genuine? So they cannot shrug the responsibility by saying this is spurious, not made by us. Then why you are not inspecting? It is the company's reputation first, then the patient if he consumes, or any boy or child consumes. If it is antibiotic, the delivery of the antibiotic, if it is less due to substandard quality or wrong storage, then the antibiotic resistance develop. And this is India's major concern, antibiotic resistance. The common use medicines. Today morning, a girl came to me in Gangaram and she said, I am taking medicine for 9 days and my fever is not subsiding. What is this? So maybe one reason could be this also. That also we should keep in mind while we are seeing the patients. This is a great problem. India is a huge country. Every lane, every mohalla, every street has got a chemist shop. The person goes and buys the medicine from the nearest chemist shop. He buys, he stops on the way, buys the medicine. So how to establish quality control? This is big question. I congratulate CDSCO to bring this under scrutiny, and I congratulate all the channels are doing this program. I've spoken to 5 channels since morning. So why this is happening? Because of poor supervision, poor production, poor quality control, poor hygiene, poor education of those people who handle this, poor maintenance of the places where these medicines are kept. Batti bhag gayi sahab, fridge band ho gaya, sare injections suba tak kharab ho jayenge. Then how to, the chemist will not throw them out. In Arjimon Mexicana poisoning, not a single drop of the oil was thrown in the drains. So we have to see, supervise, and the patient's education is also very important. Doctors cannot supervise these things. Sometimes patients bring us medicine and show, and we spot the medicines that this is not from a good company, don't take it. So this is what we can do. But chemists have a great job, great responsibility. And I would put more responsibility on the medical representatives who are the real drug inspectors for every shop, because they visit from shop to shop and their company trains them for this. You go and supervise because it is the reputation of that company. This I was reading, Grammy Pride and made by Torrent was found spurious. Tell me certain. And I myself had to return one consignment of medicine for blood pressure because that was not working. So this is what happened with me also 4 weeks back. So I don't know how much this is happening. This is NSQ alert, non-substandard quality, not standard quality, sorry, alert. And this we should be continuing, and we should be continuing it. It is a continuous process, it is a regular process, and the chemist should have fear of
right,
not
Dr.
doing
Wali,
it.
it's time that the drug manufacturers wake up to this reality and ensure that, medicines of standard quality are, dispatched. Now, coming to you, Dr. Mira Desai, health is of paramount importance. They say that if health is lost, everything is lost, and people in a bid to save their health, they rely on these important medicines like paraqcetamol, Pan-D, and various other medicines. So now that this revelation has come to the fore, what are the safety concerns and how can patients tackle them?
Yes, thank you for having me on this channel. And definitely there is a safety concern because all these spurious medicine, counterfeit medicines will be substandard. There may be some ingredients which are not necessary. The dose which is mentioned on the label, it may not be there. That can result into therapeutic failure. There can be emergence of resistance, especially if it is an antimicrobial. If it is an antihypertensive or an antidiabetic drug, that can also result into therapeutic failure. And there can be some ingredients which are not required, which are of not standard quality, and that can result into adverse reactions. And that is why there is a great responsibility on the consumers and the professionals, healthcare professionals, that if they come across any adverse reaction, if they feel that the temperature is not coming down, the blood glucose is not monitored or not coming down, if the same drug patient was taking and now the drug is not working, the first thing now it should come that in spite of having all the other controls, if the blood glucose is not controlled, if the blood pressure is not controlled, you have to also keep an option that it can be a substandard drug. And this can result into a safety concern, immediately reported to the healthcare professionals. We also have a national pharmacovigilance program for drug safety that also should be reported immediately with the drug batch, with the manufacturing, and especially when you purchase the medicine, it has to be from a registered pharmacy. Please do not purchase it from online sources or any other sources which you do not believe. And that is why there is a great responsibility on the consumers, and this requires a lot of awareness among the consumers that it is possible that even the drug which will not work or it may work adversely. I really definitely appreciate, because if you look at the CDSCO website, all these standard assessment, they have been doing, the drug inspectors in all the states, they do the random assessment. And if the drugs are not found to be of the standard quality as per the labeling instruction, they are really withdrawn. And this information is immediately available on CDSCO website. Anybody can access it, as well as I have seen that it is also published in the newspapers. So I think there is a definitely safety concern, there can be therapeutic failure, and this has to be brought to the notice, increase the awareness among the patients, and immediately get in touch with your doctor who has prescribed it. Not only that, also get in touch with the person from whom you have purchased the medicine. Because all these spurious medicines, counterfeit medicines, they will look alike. And especially the branded products, because obviously these spurious drugs are made to deceive the consumers. And obviously the intention is financial opportunity. And that is why this has to be immediately brought to the notice of the regulatory authorities, the healthcare professionals, and even the national program for the drug safety monitoring.
Now, Dr. Desai, since these revelations have come to the fore, do you suggest that there should be a cleanup drive wherein the CDSCO team, visits these pharma companies, these pharmaceuticals where you get these medicines over the counter, and ensure that substandard medicines are removed from being available in the market?
Correct. Yes, this has been done regularly. This is a regular practice. If you just explore the CDSCO website, all these letters, the information, all the details, which was the product, from where the testing was done, what was the problem, whether there was a solubility problem, stability problem, ingredient problem, the composition was not correct. All these details are mentioned, the batch number, the manufacturing detail, all these are mentioned. And suppose, as per the today's news item, if a company claims, as even Dr. Wali said, that the companies are claiming that this is not my product, this is done by somebody else, I think it is even their responsibility to find out who is manufacturing, marketing under their name. And that is why this is a great responsibility on all the stakeholders, I would say, the central regulatory body, the healthcare professional, the consumers, and the marketing authorization holders.
Right, my final question to Dr. Wali is that, Doctor, suppose I visit medical stores and I ask for a paraqcetamol, for example. What are the things that, as a consumer, that I have to be wary of and have to check on so that I don't, so that the medicine doesn't result in a therapeutic failure for me?
Always go to a chemist whose turnover is more, transactions are more, and a good chemist. You see, we have never heard these Bela, Nesto, Aglomed, these nonsense names. Where are these companies? Nobody knows. Buy a product of standard company and see the address where this company is located. ये कोई गांव की गली की कंपनी से दवाई बन के आ रही है, उसका पिन कोड देखिए जरा और अपने मोबाइल पे चेक करिए, आपको पता लग जाएगा सब स्टैंडर्ड क्वालिटी का. ये स्टैंडर्ड नेम्स हैं, हमको मना किया जाता है कि आप जेनेरिक नेम्स लिखिए. अब केमिस्ट की चॉइस है, पैरासीटामोल किस कंपनी की दे वो, ये एक अलग सब्जेक्ट है, उस पर मैं नहीं कंट्रोवर्सी कर रहा. मिनिस्ट्री के ऑर्डर्स हम मानते हैं, लेकिन केमिस्ट को बहुत ज्यादा अधिकार मिल जाता है इससे. वो क्रोसिन के नाम से नहीं देगा, वो झंडू और कहीं की किसी और कुछ और दे देगा. So, sorry, I have taken a name. It does not manufacture crocin. So, actually क्या है, हमको कंज्यूमर के राइट्स की जब बात करते हैं तो कंज्यूमर के और डॉक्टर्स के राइट को बढ़ाने की भी बात करनी चाहिए. डॉक्टर्स शुड हैव ए राइट टू प्रिस्क्राइब ए ब्रांडेड प्रोडक्ट ऑल्सो वेयर दी पेशेंट सेफ्टी इज कंसर्न. व्हाई नॉट? अगर इसमें हमारा कोई वेस्टेड इंटरेस्ट नहीं होता और उसको केमिस्ट को देना पड़ता है. बहुत से डॉक्टर मोहर बनवा के रखते हैं, दे हैव ए स्टैम्प, डू नॉट सब्स्टिट्यूट माय प्रिस्क्रिप्शन. तो ये एक बड़ा इशू है, बड़ी कंट्री है, ये थोड़ा मतलब इसको मैंने आपसे शुरू में कहा था, इट शुड बी ए कंटिन्यूअस प्रोसेस, इट शुड बी डे टू डे प्रोसेस. Inspecting drugs is a responsibility of primary company whose reputation is strict. And don't buy this Belanesto Aglomet type of company's medicine. I would say I may be offended by them. They may be offended by me. But there is a name which a company earns after decades of continuous quality service. Like when I was a child, there was a company Boots and there was a cough tablet Cherana. Why I still remember that name? Because it went into my brain. So there are certain medicines which imbibe the quality in our minds and they are really good and they have to be maintaining the quality by quality control, which is an absolute process. We are dealing with a life. We are not giving these tablets to a wooden log. We are giving to our precious children, sometimes 1 day, 2 day old. How will they digest the impurities?
That's
How
why,
will
doctor,
they
like you
swallow
clearly
the
mentioned,
tablet
the
which has got
responsibility is in the
substandard
hands of the
antibiotic?
patients as well as the drug manufacturers. Drug manufacturers must ensure that standard drugs are being dispatched to
have
all
fear.
these pharmacies.
They should have
and
fear for
consumers,
stringent
like you
punishment.
clearly mentioned, should also check up on the names of these medicines, the contents, and also the manufacturing date and whether they pass the quality test or not. Many thanks, Dr. Wali and Dr. Mira Desai, for joining us on this broadcast.